You're not going to believe the secret to successful bariatric surgery. So what that means is we have to create a personalized, comprehensive plan for all of our patients. That usually includes multiple specialists involved with patient care. The personalized plan starts with a consultation with the surgeon. The surgeon will then evaluate the patient and decide what would be the best weight loss operation for that patient. Every patient has different medical conditions, and so there are certain times when a surgeon may choose a sleeve gastrectomy, or certain times when a gastric bypass may be more appropriate for a patient. This is where a patient has a personalized surgery that the surgeon chooses for them. From there, a personalized plan has to be created preoperatively for the patient. Preoperatively, the patient does have to meet with a dietitian, an exercise physiologist, a bariatrician or a medical weight loss specialist, and a psychologist. All of these people work with patients preoperatively to create the right preoperative plan to pre-educate patients on what to expect with surgery. Your postoperative care is also specialized for each patient. The dietary intake, the protein intake, the exercise regimen is all patient specific. And this is why we work closely with a dietitian who specializes in bariatric surgery to help patients create their personalized plan for after surgery and caloric intake and certain foods that can be tolerated. Your postoperative diet will largely depend on if you have diabetes, for example, or you have other conditions where your caloric limitations may apply or sodium levels have to be kept lower. So there are multiple limitations and multiple considerations when creating a patient's dietary plan with our bariatric dietitian. The exercise plan after surgery also has to be tailored to each patient. We strongly support a comprehensive plan for all patients. So that involves dietary changes with the dietitian. Exercise is a key component to success after surgery. So we have patients work with our exercise physiologist, and they create an exercise program that is specified for each patient and what they can tolerate after surgery. Examples would be some patients have arthritic issues or back issues, and so they can't exercise maybe like other patients could that were healthier, that don't have limiting issues. As part of the personalized postoperative plan, our bariatric nurse practitioner works with patients routinely after surgery at regular visits to check in for weight checks, dietary checks, and then also for coaching on how they're doing after surgery. This is a key component to success in order for patients to stay on the correct path after an operation. Patients also have emotional and psychological needs. Some of this can be addressed with our bariatric nurse practitioner with coaching. Other times, we do use our bariatric psychologist for mental health support after surgery. Long-term follow-up is also key to long-term success. And that's why a personalized plan is so important, because it has to be a plan that a patient can actually follow in the long term. And because what we're talking about here is long-term weight loss, and the only way you can do that is if the plan is something that you can follow in the long term. And these long-term changes would be exercise changes, dietary changes, and also changes in your mental health that go with weight loss as well. Schedule a free consultation today by clicking the link.